This is the All One Nurse podcast, where we are bridging the gap between the stethoscope and the soul and getting back to the human side of healthcare.
Powered by Riverside.
Welcome to the All One Nurse podcast, where mentorship meets mission and every story is a step toward healing. I'm your host, Shenell Thompkins, and today's episode is one that speaks directly to the heart of maternal health, maternal advocacy, and nursing resilience. As we continue through National Immunization Awareness Month, this month of August, we also shine a light on a sobering truth. In the United States, Black women face a maternal mortality rate of 50.3 deaths per 100,000 live births, more than 3 times that of white women, according to the CDC. Now, these numbers aren't just statistics, they're stories. And today, we're going to honor them. Our guest, Rachell Dumas, who is an RN, is a fierce advocate for maternal health and the founder of A Light After 9, which is a nonprofit born from her own journey through 9 pregnancy losses. Yes, 9 pregnancy losses. Her story is one of faith, perseverance, and purpose. Her voice is a beacon for women navigating the complexities of the healthcare system. And today we're going to I want you to lean into this conversation with compassion, advocacy, and the belief that every nurse has the power to change lives, starting with their. So this topic may be sensitive, so I encourage you to either save this episode for later if it's too soon, or skip ahead as you listen. Our intention is not to rehash trauma, but to facilitate healing and understanding for all listeners. One thing I've learned personally is that I am not alone in my own experiences with pregnancy losses. Now, I'm so honored to introduce my amazing guest speaker because of her own personal journey of loss and ultimately resilience. And after enduring 9 pregnancy losses, she transformed her grief into a mission of support and empowerment for families facing fertility challenges and pregnancy loss. And her nursing experience have positioned her to lead with both professional expertise and compassionate insight, reshaping how maternal care is delivered in times of deep personal crisis. In addition to her nonprofit work, A Light After 9, Rachell is a passionate public speaker, advocate for equitable healthcare, and she's shared so much on platforms like Under the Sisterhood podcast, Dear NICU Mama podcast, Nurse Rosa's Insights, and Modern Nursing. And also, she's been on Capitol Hill, like literally went to Capitol Hill. And her story transcends personal healing and calls for a systemic shift in the way that maternal health is approached, especially for underserved communities and women of color. Through her advocacy, she challenges the conventional healthcare system to prioritize both mental and physical well-being, ensuring that no family's struggle goes unnoticed. So whether you're a healthcare provider, a student, or a patient, this episode is for you, and definitely for our women who have experienced their own woes with pregnancy and childbearing. Now, please do not hesitate to subscribe and share this episode with others, and be sure to stick around until the end of the episode so that you can find out what Rachell is up to, how to connect with her, and what's to come on the podcast. And if you're a nursing student or new nurse seeking mentorship, I invite you to stick around so that you can learn more about my 10-week mentorship program, which is designed to build clinical confidence, academic success, and spiritual resilience. So let's dive right into it. Hey, Rachel, how are you doing?
Good, how are you?
I'm doing good. It's so good to have you on the All One Nurse podcast.
Thank you for having me.
Yeah.
I'm excited to be here.
Yes, ma'am. Now, I must say, tell us about you. Tell me about your nursing journey.
Yeah, so I have a pretty unique nursing journey, I would say. I started as a nurse extern in nursing school. And before that, I was a patient care technician. If I did my first class in nursing school, I was eligible and I started at the level 1 trauma center here in Atlanta, which I love. A teaching hospital. I mean, you see everything. You see everything. And I was in neuro ICU. Once I became a nurse, I went to surgical trauma. I would wake up, look at the news, and that'll be my patients for the day. So it was that type of ICU. You know, we saw everything. Shortly after I started being a nurse, I went back to school for my graduate degree, and like maybe a few months. And I originally went for nurse educator, and that took a change. I ended up pivoting after that because a lot happened personally. I started my pregnancy journey at the same time. I clearly lost my mind doing all this at the same time, but here we are. But I started my pregnancy journey, and that was anything but cookie cutter. And it took me years to have a baby. During that time, I got into nurse informatics and will pursue my master's in that. During that time, I also wanted an array of experience. So I did education, I did OR, pre-op, post-op, I did a little med surge, ICU step down. I mean, I done so much. I did anything but mother baby and maternal health, which is ironic because I intentionally stayed away from that specialty because I didn't feel like it was for me at all, which my pregnancy journey will teach me otherwise. But I started my master's shortly after, and it took me 8 years and 3 months to finish that degree because of my
Really?
pregnancy and health journey during that
Really?
time. But
Now, is this the master's for the informatics or?
yep. The master's in
Really?
nursing informatics that I just finished in April of 2025.
Yeah.
And yeah, I finally finished despite of all the the health issues that I had. But I finally finished.
Awesome. Well, congratulations, first and
Thank
foremost.
you. Thank you so much.
And I think that's encouragement for anyone to just keep going.
Yeah, just to keep going. Don't let any adversity stop you from, get your degrees or obtaining any goals that you have.
Focus on those challenges, which in your experiences came your nonprofit, A Light After
hmm
9. So tell us a little bit about that.
Yeah, so my other baby, a light after 9, was birthed out of pain that turned into purpose. Like I said, during my graduate school career, I started my pregnancy journey and I had 9 losses throughout that time. And honestly didn't know if I would ever have a baby that I would take home and be able to be a parent and raise. I say a parent because I truly believe all the stuff that I did during that pregnancy journey, I earned mother as a title. I earned it. I was flying across different states to have surgeries to keep babies. It was just a lot. And I was told that after my first miscarriage that I would easily go on and have a baby. I was young, and that was anything but true. And I went on to have twins the second pregnancy. And I was in and out of the hospital with excruciating pain, bleeding, all these things. I kept being sent home, try to advocate for myself, and I lost the first baby. And then my symptoms went away, and I was told that, oh, you're fine, you'll have this baby. And then I wake up one day wet, and then I go to the bathroom, and the baby falls out.
Oh my God, you were at home?
I was at home on literally with a house full of people for my gender reveal.
Mm.
So luckily my support system was there and easily accessible, but it was a very traumatic loss. And I was diagnosed with cervical insufficiency, which, like I told you earlier, I was avoiding maternal care. I didn't know anything about all these diagnoses and treatments and surgeries and medications in this specialty. So while I could save a life very, very easily from my experience, it was hard to advocate because I didn't have the education to do so. So I was very reliant on my healthcare providers, which a lot of times was a fight to get them to even believe me when I told them my symptoms were my symptoms, which led to 9 losses. So I got the surgery that I needed around my cervix to keep a baby in. And I was told that I have a baby then. And that failed. And that doctor who put it in casually at 20 weeks told me to go give birth because it failed and there was nothing that could be done. And I said no. This is the longest I have been pregnant. This was like my sixth pregnancy.
Yeah.
And I'm like, I have to fight for this baby. We're, 20 weeks. I can't just like go that easy.
Right.
So I asked her to redo the cerclage and she said no. She said, that's not the standard of care. So I'm not doing it. You can go and give birth very casually, very casually. So I gathered my village and everybody I knew, our coworkers, anybody I could think of. And we found a doctor in Texas who was known for flying patients out and doing high-risk surgeries like that. He had even saved twins at 20 weeks. So I was like, well, I
Wow.
just had one baby.
Yeah.
Can you do
Yeah.
one miracle for me?
Yeah.
So I flew out like that night and he rolled out the red carpet. I have never been cared for in a healthcare setting like I was there. And he did the surgery, but that 3-hour surgery took 8 hours. Because
Wow.
as you can imagine, I was on a plane. I was already dropping. Like my baby was already dropping. It was just a lot. And he had to push the baby back in. And while the surgery was successful, I did, after anesthesia wore off, start to go into labor. And they gave me so many medicines, tocolytics as we call it, to stop contractions. But I was in labor for 30 hours and then my water broke and I had to deliver that baby. The kindness that I was shown by that surgeon, he told me prior to that surgery that he would bring me back out, no cost, and perform that surgery if that was to happen. And sure enough, later that year, he brought me back out, did the surgery, everything went well while I wasn't pregnant. And then I went on to have my baby in 2022, who is now a potbelly 2-year-old running around here.
Oh my God. Yes.
Yeah. But it took time.
Rachell, I don't think anybody's ready to hear your story.
It's hard to tell though. So
Man.
hopefully it inspires somebody to keep going or to start or to advocate for themselves or to not listen to the people who saying you should stop,
Yeah. Yeah. So at what moment did you feel like someone else deserves to be treated the way I was treated by this provider, this physician, this surgeon? Like, do you feel like that was the pivotal moment?
So I realized that when I got to, actually before I got there,
Okay.
when I talked to that man on the phone at 10 something, he was like, you need to come here. I was like, this is the type of care I would love anybody to hear. Is that expected of a doctor? Absolutely not. Absolutely not. I'm not thinking like my doctor should call me at 10 p.m. and just be like, catch the radar and take care of you. I do not expect that type of service. But I do expect my doctor to listen to me and believe me when I tell you what's going on. 100%. I expect that.
Yeah.
I deserve that and that's my right. I do believe you should have given me all options. Had that surgeon that put in the original cerclage said you could have got a transabdominal cerclage that's permanent and you wouldn't have to be touched again, I would have chose that option. So when we were talking about informed consent, I only had consent that was done for that surgery. It was not completely informed. And I do expect my provider to give me informed consent, giving me all my options. And when I met Dr. Fogwell, because I have to say his name every interview, Dr. Fogwell at Texas Health, when I met him and how attentive he was at my bed 1 a.m., 3 a.m., 1 p.m. I asked him, like, do you sleep? Like, are you a vampire? Why
Yeah.
are you here right now? I didn't expect him to give me his cell phone. Any orders we were discussing via text, like, I think we need to try this tocolytic or this might be better. By then I probably had out. But just kidding, because y'all, I cannot do what y'all do, OBs and midwives. So, but I do expect and would love for other people to experience at least a portion of how amazing Dr. Fogwell was and his team. I mean, that was a very traumatic and vulnerable moment. And he made it okay.
That's awesome. Thank you for sharing that. So how did you find strength during this time of experiencing what it seems like hurt after hurt, pain after pain?
So my strength came from multiple sources and at different times. I would be a liar if I was like, yeah, the whole time I was just a strong soldier. I just knew I was going to have a baby. It was times I felt very weak many times. But the strength came from my providers, some of my providers. They were like, well, we haven't tried this yet. We have to try this. We're not done yet. So I was like, okay, I'm the type of person who exhausts all options first before I quote unquote give up or throw in the towel. So that was one source. The other one was my talk therapist who I still see every week. Like, I don't know well, I do know I would not have survived this tumultuous pregnancy journey had I not had therapy. And just my village, like my village, maybe they didn't agree with every pregnancy and that I kept going. I'm sure they just, because they saw me hurt and they saw, when the baby fell out during the gender reveal, it was so many horrible moments that they survived with me that it was hard for them to watch, but they were unwavering in their support. Even when I was like, well, I'm trying one more time. This is baby number 10. We're going to just see. This is the last time. And they, stuck with it. The canceled baby showers that we had and all of the tears and the prayers and the appointments. And so it was really a combination of those things at different times that kept me going. In addition to the desire to want to be a mom and a parent.
Yes. I see where you're coming from with having hope. You have that hope that's undeniable, like hope that can't nobody take away. And when it comes to like family loves you. So they don't want to see you hurt. And a lot of times with our natural eyes, we just see the patterns. We see what has happened. But when we have hope and we have faith, we can believe for what's to come and what we are desiring to come, which is that successful pregnancy, that healthy baby. And by the grace of God has showed up in both of our lives after having pregnancy loss.
Right. And the thing is about like when God gives us assignments, other people don't know your assignment.
Right.
They just see you doing the work and see the adversity that you're facing. They see the wins. They don't know the assignment and what it all means. And sometimes we don't always put it together.
Right.
I knew that I was going to have a baby. I didn't know when and I didn't know how. I didn't know if it was natural or what it was.
Yeah.
But I did know that this was my journey and I had to accept that, as hard as that was.
Yeah.
And when a promise is placed into your heart and a gift is given to you, such as motherhood is, it doesn't matter if other people can't really understand and comprehend it fully. But as long as you know and you stay steadfast on that journey, that's what matters.
Yes, I agree. I stand and agree on that. Thank you for sharing your story. Thank you for just coming out the gate with what you've experienced. And I think that what really drew me to you, to be an individual, a woman who has suffered so much loss, but yet you come out with a whole non-profit foundation, right? To advocate for patients, for maternal health, both on the healthcare side and on the patient side, because you're a nurse. You're a nurse and a patient.
And a patient.
And it's funny that the one thing that you wanted to stay away from is the main thing you get a life lesson in.
It is. Ain't God funny?
Man, I'm telling you.
Like, the jokes just write themselves at this point. But they say, tell God what you want to do.
Right. And he's probably like, oh,
right.
Sure. Let's see what you gonna do versus what I'm finna allow.
Right.
Yes, that's God for us. So, with All One Nurse being catered to supporting new nurses and nursing students in your professional journey, just going back to getting through nursing school and getting your master's, what is something that you want to tell new nurses and nursing students before we actually get into your patient perspective and your educational insights?
So my nursing experience in school was very different. I can't give you advice about, I can, but I'm going to refuse to give you advice about how to make it through school and the curriculum. We know it's hard. I think it's in the World Guinness Book of like the hardest degree. It's like the BSN. Like, I think it is, if I'm not mistaken. Like, we know it's hard. The tests are like, which orange is most orange? Like, we know.
That's true.
We know how it is, You're going to survive that. The issue is life happens at the same time. Life does not stop while you're in nursing school or doing anything or achieving any goals. The thing is that you have to be resilient throughout nursing school or else you're not going to make it. I promise you, when final happens, that's when somebody's going to pass that you love. That's when you can't afford your bills because you're trying to pay for nursing school. You're almost homeless. You're having a mental breakdown because it's too much. So you have to support yourself and get yourself to a point where you're resilient through adversity. Because we know how nursing school is at this point. It's the outside factors that impacted me. When I started my BSN journey, and I've never said this before, I flunked out of nursing school because I couldn't afford my bills and I had to work. I could get up there and teach lectures in the class. There was one professor, I'm not gonna name her because I don't want to get in trouble, but she used to let me teach the class. That's how much I knew. But I would like miss a whole exam because I was too busy working 2 jobs. So I wouldn't be homeless. I had eviction notices. Thank God I didn't get eviction, but multiple eviction notices on my apartment door when I would come home after a long day of clinicals. So
Rachel.
it was like, right, it's crazy. My story is crazy, but I survived it. And to think that my master's will be easier. Yes, the work is easier because it's papers and it's just easier. It is easier, in my opinion, my MSN. But life happened again. Again.
Yeah.
Like, again. So that 2-year degree took 8 years and 3 months because life kept happening.
Kept happening.
So if I
Yeah.
didn't have resilience and built up resilience and be able to survive and even thrive through adversity, I wouldn't be a nurse. I wouldn't be a nurse. So
Wow.
that is my advice: to take care of yourself as much as possible. Seize the good moments because they're
Mhm.
temporary, but so are the bad ones.
Yeah.
And try your best to build up that resilience and just know that these horrible moments are temporary, just like the good ones, and just keep pushing. Just literally keep pushing through it.
That's good. My father-in-law, he said that we can't make permanent decisions off of
Mhm.
temporary situations.
Mhm.
And when he said that, I was like, that is so true. So true. So don't give up when
Right.
things are hard
Right.
because it won't be hard always.
It won't.
Thank you for the advice, Rachel, for nursing students and for new nurses,
Mhm.
because I've also found that they're struggling.
Yeah.
And I'm just like, did you eat breakfast? Do you eat before you go to work? Do you
Right.
take breaks? And they're just like,
Right.
no, I just want to make sure I do everything. And I'm like, no, you're running on empty.
Right. You're heading
Empty.
to a burnout.
Yep. Heading straight to a burnout. And the last thing I desire for new nurses is to burn out and then leave the profession altogether.
Yes. Yes.
When you really went into it with the right intentions of wanting to
Yep.
care for others, but there was no balance, no
Right.
boundaries.
Right.
So
Yeah. Right.
I'm glad you spoke on that. Just listen, just listening into your story and just going back to your pregnancies, your pregnancy
Mhm.
losses. Could you explain the cervical insufficiency?
Absolutely. So cervical insufficiency, also called cervical incompetence. I hate both of those terms, but you don't want to hear that you're incompetent or insufficient after you already didn't have pregnancy loss. But it's often diagnosed when you've had multiple late pregnancy losses, like later in the first trimester, early second trimester, late in the first trimester, when the baby is heavy enough to sit on your cervix and cause it to open, right? So your cervix is too weak to carry the baby full term. And the treatment is a couple of things. It depends on where you are, who your provider is. But the treatment is you can get or be prescribed suppositories, specifically progesterone suppositories, which is supposed to strengthen the cervix if your progesterone is low. Some providers feel like, regardless of if your progesterone is low or high, those suppositories do help. Others do not believe that. There is another treatment that is more effective, which is a cerclage. There are multiple types of cerclage. The typical one that you put in first is a cervical cerclage. So it's a cerclage that's lower on the cervix, and you put it in around 13 weeks, give or take a few weeks, and you take it out around 36, 37 weeks to deliver. You take it out before then if there are complications that require it to be removed. There's another cerclage called a transabdominal cerclage. That cerclage is placed higher on the cervix and has more efficiency rate and is a permanent cerclage. Unless you have like infection or something that requires it to be taken out, it's left in you forever. And with that one, you have to have a C-section because it stays there. So the other cerclage, ideally you would have a vaginal delivery because they remove it at about 36, 37 weeks.
Okay.
Yeah.
Okay. Thank you for explaining that.
Yeah, I hope that was helpful.
Yes, that's very helpful because sometimes people don't really know. Like they may have heard the diagnosis, but again, if they're not
Mhm.
if they don't know how to advocate for themselves, knowledge is power.
Right. And these are things that I had to look up and I didn't know about. I'm not learning about cerclages and trauma. That is not
Right?
It's not the type of trauma that we are, learning about when we think about being a patient ourselves and having to advocate. And like I said, you can't do that without education. It's also important to get your education from a credible
Yeah.
source. So I always, and granted, I've been in school forever and probably will be for the rest of my life. We do a lot of research, and where that research comes from is very important.
Mhm.
So if you can always look up credible sources like Mayo Clinic, Harvard has their different research, and Emory does, and there are so many different places who do. But if you can look up peer-reviewed articles that are credible, just to give you more information. Everything on the Google search is not credible.
Right, right. Thank you for sharing that. When I went through my miscarriages, I think the main one was the DNC. I had to decide
Mhm.
whether or not to get a DNC or take medication at home. And I actually went to work that same day just so I could look at resources and talk to other women.
Mhm.
And come to find out, I really got some good sound advice from them based off their own experiences. And I looked on Up to Date because it was,
Yes.
provided through my organization. So that really helped me make a decision to do the DNC at the time.
Right. And it's not just the research you find, right? Like you said, we're also talking to our counterpoints.
Yeah.
That's why these sister circles and mom circles and cerclage groups and different things like that are so
Mhm.
important, because yes, we have research as well, but if my sister, my counterpart, my friend has been through this and been there, done that,
Yeah.
they can probably give me things that can prompt me to ask my provider that couldn't even find in a Google search or on
Yeah.
research. Because especially this day and age, a
Yeah.
lot of funding has been cut. So
Yeah.
what that means for the common person and healthcare and the patients receiving healthcare is that we're not always going to have up-to-date research because of this
Mhm.
funding being cut. That's how it's going to translate and impact us. We're not always going to have research for Black women. There's a lot of research that was done on a white man. That doesn't always translate to care for Black women or women. It's also good to do the research, but also talk to people. See if somebody's been there, done that. Also ask them what their experience was. What did it look like when your psychology was failing? Am I having those experiences? Can I speak up to my provider? How did you speak up? Bring that
Right.
research to the appointment. Say, here, put it on the table like a, like listen, this is what I found.
Yeah.
Have honest conversations. And if you can have those conversations with your provider, don't be afraid to switch providers as well. That could be a very daunting task, but important.
I'm glad you said that and able to being okay with switching providers. Sometimes I think we question ourselves, like, well, I don't want anybody to be mad at me, or we just don't know that it's okay to switch providers.
Yes.
It's
Yes.
okay.
You do feel guilt in some situations. You feel guilt in some situations. If you were like me and you're just so tired and sick and you're going through so much, you just don't have it in you to do all that paperwork and switching and having them read on you and all that stuff too. And I get that. But if somebody would told me you wouldn't have had 9 pregnancy losses and you could have had one or two or something like that,
Oh,
I would have definitely switched my provider. If I would have known about transabdominal sarcoidosis and wasn't just told about transvaginal ones, I would have picked that one. So you never want to be on the end of shoulda, coulda, woulda,
right.
um, if you can help it.
And sometimes, and that's what, unfortunately, we learn from others' experiences.
Mhm.
If we honestly tune in and
Mhm.
listen, you get to learn things like this.
Yes.
And that's what I love about podcasting. That's what I love about
Mhm.
articles, research,
Yeah.
just getting that information out there for
Right.
those who need it. Jumping right into patient perspective. From your perspective, what are the most significant gaps in maternal health care that you believe patients face today?
So one of the ones that I'm most passionate about, because that is a loaded question. It is so many gaps, especially in today's political climate with this big beautiful bill and stuff. I can go on about just the disparities that's going to cause, as if we're not already in this. Oh my goodness! But yeah. The maternal health, the maternal death rate is so high, especially for women of color. As a patient, when you're going into these healthcare settings, advocacy is such a big deal. It's such a big deal, and you cannot advocate for yourself without the education. And I share my story so willingly because I need people to truly understand how important advocacy is, self-advocacy is. And I have to always disclose that I'm a nurse, just so you know just how difficult it is to advocate for yourself in this setting. Even as a healthcare provider, it is
Yeah.
still difficult to navigate the healthcare system as a patient. And it's because, especially Black women, they don't listen to us. They don't believe us. Our symptoms are dismissed. We have delayed treatment. And then all of that can lead to our death. And here we are with this very high maternal mortality rate. So again, self-advocacy is so important. It's so important. I made it one of my life's missions to create this space where I'm teaching patients how to self-advocate, put out the education for them, but also to teach the providers with my story that I've turned into an interactive case study on how your actions or lack thereof can result in pregnancy losses and even a possible death of a patient. So advocacy is so big, so big.
Yes, ma'am. You say you turned it into a case study. Do you present virtually or in person? Like, tell me more about.
Absolutely. I do both.
Okay.
My favorite people to present to healthcare professional wise is students. You know why? Because they're bright eyed and bushy tailed
Yeah.
and they're like, yes.
Yeah.
They're not burnt out like they're not like over it. They're like, yes, I can't wait. I'm here to save the world. And
Yes.
we have to horn in on that energy.
Yeah.
And they're more open, right? So I'm getting them before they even touch a patient. This is what the current climate of maternal health and healthcare. It's not just maternal health. It's
Right.
healthcare, but my emphasis is maternal health. But this is what you're walking into. I need you to be that person that's different and challenge
Yeah.
the status quo and listen to your patients and believe what they're telling you and treat them. And also understand that everybody is not going to present with textbook symptoms. I know. I can tell you multiple issues that were life threatening right now and what I just went through with my brain. And I just don't present textbook all the time. So I need you as the new generation of healthcare providers to really listen to your patients and identify, different issues that they may have and that they might not clinically present like you think they would, but believe them.
That's true. One of the nurses that I interviewed in like my very first season, Dr. Shante Coleman, and she was a nurse practitioner and she had a stroke due to birth control use. And the provider, she was having really bad pain. I think this was the second stroke. And she said that the provider basically said that she didn't look like she was in pain.
Well, I got that a lot of times. I get that so often. And then when we don't look like we're in pain, they don't treat us, right? And there are studies to actually show that there are healthcare providers who really feel like Black women do not experience the amount of pain that they say they do or the amount of pain that our white counterparts have for the same issues. So we don't get the treatment and we're
That's
suffering.
crazy. I know we hear the term or the sentence strong Black woman,
Yes.
but we don't mean it in that sense.
We don't mean it.
We don't mean it in that sense.
We do not. I mean, even recently, transparently, when I had to get a brain stent a few weeks ago, I kept presenting to the hospital. I was hospitalized all of May. And so that tells me, like, you, to some extent, believe my symptoms are serious for you to admit me into the hospital that many times. So as I'm rolling into the CT scanner to get a venogram, I was told by one of the healthcare providers that you look like you could go home. You don't look sick. As a nurse, anybody that's in the hospital bed on a gurney looks sick to me. Oh, I'm over here. I can't even see. I can't even see. I was like, sir, I cannot even see you right now. I had an ER doctor tell me the same thing. You look great, because I had on, I guess, my Ray-Ban shades because I had photosensitivity. So I guess I look like Beyonce in a bed or something. I was like, well, I feel horrible. Yeah, he was like, we look like we could send you home. I say, sir, if you send me home, I'm not gonna make it. So I was told, and I had a hospitalist came into my room after being in the hospital for 5 days. I could not see. I was vomiting. Just
Neurological.
Yeah, or neurological. I couldn't walk without a walker. My balance was horrible. I had falls already. You already confirmed on the venogram that I had narrowing of my left transverse side. And you talk about, well, you look good. We could send you home. And you're the hospitalist. I said, sir, if you send me home, it will be horrible consequences.
It's like you can't even make this up. And you're talking about May 2025.
Yeah, just last month.
May
Yeah.
2025.
Yes, May 25. It probably won't be last month, but yes, May 2025 of this year. And then I had a fight. I mean, fight to get the stent placement sooner. By the time I was going to the OR to get it done, I could not walk. I had vomited for 16 hours straight, and I could not see in front of me.
I don't even know what to say to that. Like, you would think it's as easy as 1, 2, 3. Like, this is what you're presenting with. You have the imaging that aligns with what you're presenting with.
Right.
You know what the treatment is.
You know what the treatment is.
Just do it. Why I gotta beg? Why do I have to beg to
Literally
be treated?
begging. Literally begging. And they were trying to do it June 19th. So I wouldn't have made it that long.
Because
for
you're
these
already symptomatic.
I'm very symptomatic. Like I literally, I wouldn't be able to see you on the screen. That's how bad it was. Yep. And I have a baby, right? So there were
Yes.
times like I have pictures of my baby like in the hospital with me. So it was just, I always go back to how important self-advocacy was.
Yeah.
But in this case, in May, I was definitely using my neuro ICU experience
Yeah.
and knowledge. I got my surgery in Kentucky. I was calling counterparts, like Dr. Webb in Atlanta. He talked to me, helped me advocate for myself. The nurse practitioner I work with, I posted on LinkedIn, and these neurosurgeons was calling
Come
me.
on.
People had reached out to me, was like, I know a neurosurgeon. So you could talk to them, because it was also like, should she get a VP shunt and a stent, or the surgery? Because that might be another reality that I might need a VP shunt. But I talked to 7 neurosurgeons, 7.
Wow.
And I'm using everything they're telling me, statistics. We're having conversation. I'm able to be empowered to advocate, because while I am a neuro ICU nurse as well, I'm still a patient and I'm sick. So I'm just like, I need help. And they were there. But then I think about the common person in the hospital. Don't have access to all these people. Don't have the knowledge base. They're sick. You don't feel empowered while you're sick to have these conversations. And then without the education, you can't advocate for yourself. So I'm like, what are these people doing? They're dying. Or they're severely debilitated. They're not making it. So it's just scary.
That's very scary. Very scary. Keep going deep on me. You keep going.
It's a lot to talk about. It's a lot to dissect. I'm gonna send you to counseling. You're gonna need a therapy session.
I'm telling you, some good prayer. And but I know God makes no mistakes. I don't wish anything on anyone.
Right.
But I know as long as we're in this world, we're not exempt from the things that may happen in this world. But man, when it happened to someone who is going to take the experience and preserve others with it, because you're going to tell the story, you're going to share your testimony like you are now. And so I'm just like, okay, God. I mean, what else we got coming? Because it's a light after 9. So what else? There's a light after this too, because
I do have something else I am working on too.
Yeah.
That was birthed during this previous say that is coming soon. Hopefully we can do another podcast. I can't speak on it now because it's in its infancy, but I do believe that it will save a lot of lives and potentially change the face of healthcare. So I'm excited to share that when I'm further along in this project.
Yes. I can't wait to see what you are working on, because I know it is going to be awesome. And I know God is doing his big thing through you. I just thank God that you are whole, that you are well, and that you are back home
that
with
I'm
that
back home.
precious son of yours.
Yes.
Yes.
I wonder if I will be back here, to be honest. My faith did get very weary at some times. So, which I think is just normal.
Yeah.
You're going through. But I'm so glad to be home, and I'm so glad. And when I tell you night and day, a month ago, I could not see you, and here, like, my vision is better. Even my hearing is better. It's crazy. So I could walk and I could pick up my heavy little boy.
Yes. Don't do too much.
I know, not too much. I feel like I have superpowers now.
Yeah. And that was going to be my one question. Like, how are you doing with everything?
I feel great. Like, I feel great.
Awesome. Awesome. I really, really, really appreciate you, Rachell, for sharing your nursing
Thank you
journey.
so much.
And most of all, your personal journey.
And this time, working personal definitely mixed.
Yes.
I would not choose 8 years and 3 months to finish a master's degree. at all. And so I'm crazy to even start this doctorate journey, but just pray for me nothing else happen, Lord.
So with your doctorates, are you going to do nursing practice and
The doctorate of nursing practice, yes, it'll be a DNP. And I know my mentors are gonna hate me because I got like so many letter of recommendations for public health, which I asked y'all. And I love y'all so much. I'm so sorry, but I'm gonna stick with tech. And I'm going with nursing because that is my assignment.
got you?
That is my assignment.
Look, don't be letting people down on my podcast. Yeah.
I know they're gonna be like, girl, you had us write these letter of recommendations. And I love y'all so much. I'm gonna use them for something.
Yes.
Grants or something, the testament of my
Yeah.
character.
Yes. Well, this is awesome. I'm gonna have to stay connected with this
Yes.
doctorate journey myself to see how you're doing.
Yes.
Yes.
Please check on me. Check on your
Yes, ma'am.
doctoral candidate friends.
Yes. It's gonna be Dr. Rachell Dumas.
Yes.
Yes. When's our projected date? Graduation.
So I'm projected to start August 19th, which is the day before my birthday. And it's a 1.5 year program. As long as I could get clinicals out the way in a decent amount of time, it'll be a 1.5 years. So not crazy.
You are one busy woman,
Yes.
but blessed nonetheless.
Yes, definitely.
Blessed nonetheless. Now, how can listeners connect with you?
Absolutely. So professionally, you can connect with me on LinkedIn at Rachell Dumas. It's MSNRN behind it, soon to be DNP. But I love to connect on LinkedIn. As far as if you would like to have access to our services, which is helping vet and find providers, healthcare providers during your pregnancy journey. If you would like to participate in the mom to mom mentorship or the momtorship program that we have, or see where we're at. I'm always doing public speaking. I'll be at Shades of Blue Maternal Health Conference. You can go on our social medias, which is A Light After 9 on all social media. And then you can also visit our website, alightafter9.org, and see what's new. And if you would like to donate, we take donations as well. We have a lot of upcoming events, so please follow us and just stay connected.
Awesome. That is great. Well, Rachell, I pray that God continue to bless you in all that you do, that He go before you and continue to light your path as you light up everyone else with your experience, with the purpose that God has given you. You are truly a blessing.
Thank you so much.
Truly a
Thank you.
blessing. Thank you for being with us. And I will definitely put all the details of how to connect with you professionally on LinkedIn, as well as the website, A Light After 9, down in the descriptions below. Thank you, Rachell.
Thank you for having me.
Thank you for joining me and Rachell Dumas on this powerful episode of the All One Nurse podcast, where we dove deep and unpacked the gaps in maternal health care, the challenges that women, especially women of color, face in the clinical setting, and the critical importance of self-advocacy, even when you're a nurse navigating the system as a patient. And Rachell's story just reminds us that education and shared experiences are tools of empowerment and that our voices truly matter. And I really thank her for getting on with us today. Now, coming up on the All One Nurse podcast, I'm sitting down with Brianna Corbett, a fierce advocate for underrepresented and minority communities, and a rising voice on TikTok, where she's known as at I am _ the real RN. And we're going to be talking about authenticity, advocacy, and what it really means to show up online as a nurse with purpose. And I promise you, you do not want to miss it. So if you haven't already, go ahead and subscribe to this podcast. Now, if you'd like to support the podcast and keep these conversations flowing, you can buy me a coffee. And you can find literally a link down in the description below from wherever you're tuning in from that says buy me a coffee. Click on that link, and any amount, I am grateful, humbly grateful. And also, while you're in the descriptions, check out All One Nurse Linktree, where you'll find information about the All One Nurse 10-week mentorship program. You'll find free guides and resources to help build your confidence and ways to connect with me, your host, Nurse Shenell Thompkins, across all the different social platforms, as well as nursing items on Amazon. So go check that out. And I just want to also give a special shout out to Nurse Converse, podcast presented by Nurse Doc, because with their support, I can bring these interviews to a wider audience. And if you've been inspired by today's episode, click the referral link in my link tree or in the descriptions below and refer me on Nurse Converse. Together, we're building something so much bigger. Now, until next time, I want you to stay grounded, stay bold, and remember you are never alone in your journey, and continue to let your light shine. Bye.